Yeah, so Ekta, before coming to this, I just wanted to touch on the numbers point.
Right.
So guys, look, I will take from where, my friend left. Obesity in India is very different from what obesity we've seen from US.
Got it.
The numbers which US is throwing up are of a very different population, right? All of us know we are thin, fat Indians.
Yeah.
Yeah.
Look at the room around. Do you find anybody who wants to lose 20%, 30% body weight? So all that conversation which is happening about 20%, 30% body weight is largely not for our country.
Got it.
If we compare with the same BMIs, then our obesity is 4%. Our population is 4%. We have a problem of 2 to 5 kg extra visceral fat.
Yes.
Correct.
That's the reality. So what I see, responding to you, how many patients can come in. Look, guys, what happened to US in the late 90s? There was a huge turnaround in cardiovascular death. After the Second World War, they kept on going down, and 30% of all deaths were happening because of cardiovascular reason, cerebrovascular and cardiovascular. And then came statin.
Yeah.
And post-statin, early 2000, that was the first time everybody celebrated globally because they have been able to push back the whole thing, reverse it actually, in only 10 years' time. What LDL meant to a Caucasian, population, not taking away the lipids, very important part. That is what that visceral fat means to us.
Yeah.
Got it.
Right?
Yeah.
So when we see the guidelines, say we put the ADA guidelines as a funnel and pass our population through them, 70% of all people with diabetes will greatly benefit out of semaglutide. Greatly benefit out of semaglutide. Right? Guys, before talking about reducing obesity, this is the only drug which can be taken, for example, semaglutide 0.25 milligram to 3 milligram, 12-time escalation in a dose without getting hypoglycemia.
Wow.
Yes.
So the new target of HbA1c for this country might not be 7. And 70% of people not controlled might not be true. So that is where the crux of the thing is. I'm happy to see the advertisement. They all look very good. But our problem is that visceral fat.
Yeah.
And I think that will turn the population if you simulate it on an AI, right? That if a large population gets into GLP, now whether they get in on pens, on some other fancy devices, or some vials, that's not my problem.
Yeah.
But if a large population can get through, we are going to see a huge change in the next 10 years.
Okay, that's interesting to know because that'll be a completely different market. But if you could just go back and answer my first question, how many companies are we going to see launch semaglutide and whatever it might be? What is the price correction that we might see in the market? And hence, your point about accessibility, which might increase exponentially once there is price reduction in the market.
Okay, so give us 1 year. This has been the first time, so the regulatory has taken a lot of work. Give us 1 year. As an Indian company, we should have a shot, a weekly shot available at $400-500.
Wow. $400-500.
Wow.
Now, whether it comes through a syringe or it comes through a pen or it comes through some different source.
Is that what you're saying?
I don't know. I don't know. But look, these are all, imagine 70% of diabetic eating.
Yeah.
So give us a year's time. We will make it accessible for 500 rupees a shot.
Wow.
That's what I think is going to happen.
What about you, Mr. Bakshi?
Yeah, if semaglutide was an IPO, then I would not like, it's not the listing gain which would happen. So, at least a year down the line. But this is something which is really big, building up very well. Very important, we talk about, consumption patterns.
Yes.
Let's think about the productivity patterns, right? If we lose that kind of adipose, if we get our HbA1cs on track, if we avoid complication, look at the productivity which we gain, right? So it's a fantastic IPO. I would go all out and invest in it, but will not wait for the pop. We'll give it a couple of years. From a company's point of view, I completely agree. Having a cold chain understanding is a good idea, right? This is again a lot of patient care, right? Now, patient care, if there are two kinds of selling in India, One is without beating the patient, and other is, beating the patient. So the beating the patient is very sensitive. It develops over a period of time. Developing cold chain is easier said than done.
Yeah.
Right? So yes, a little bit advantage there because, insulins and all those things are a advantage. But a very good thing, it might take away a little bit here and there, but end of the day, the diabetes market will really become very big.
Okay.